How do neurotransmitters affect depression and anxiety? Imagine your brain as a busy city where chemical messengers called neurotransmitters are like delivery trucks moving important messages between neighborhoods. When these trucks run smoothly, your mood and emotions stay balanced. But if they get delayed or send incorrect messages, it can lead to feelings of sadness, worry, or fear. That's what happens in depression and anxiety. Serotonin is one of the main neurotransmitters involved. It helps regulate mood, sleep, and appetite. When serotonin levels are low or its receptors don't work properly, people often experience feelings of sadness or worry. Many medications used to treat depression, called selective serotonin reuptake inhibitors, work by increasing serotonin in the brain, helping to lift mood and reduce anxiety. Norepinephrine is another important messenger. It influences attention, alertness, and how your body responds to stress. If norepinephrine signaling is out of balance, it can make you feel overly anxious or depressed. For example, too much norepinephrine can heighten feelings of fear and hypervigilance, common in anxiety disorders. Conversely, low levels might contribute to feelings of fatigue and low motivation seen in depression. Dopamine is often called the feel-good neurotransmitter because it's involved in motivation, reward, and pleasure. When dopamine pathways aren't working well, it can cause a lack of interest in activities and feelings of emptiness, which are typical in depression. This is why some treatments aim to boost dopamine activity to help restore motivation and Glutamate is the brain's primary excitatory neurotransmitter. It plays a key role in learning and memory but also has a part in mood regulation. Abnormal glutamate activity can lead to reduced connections between neurons, especially in areas like the hippocampus and frontal cortex. Chronic stress can increase glutamate's excitability, which may contribute to depressive symptoms by damaging brain cells and disrupting normal mood regulation. In essence, depression and anxiety are linked to complex changes in these neurotransmitter systems. When these chemical messengers are out of sync, it affects brain circuits that control how we feel, think, and respond to stress. Treatments often aim to restore this balance, but it's important to remember that each person's brain chemistry is unique. For those living with neurological conditions like brain tumors, disruptions to neurotransmitter systems can be even more significant. Tumors or treatments like chemotherapy and radiation can interfere with these chemical pathways, making symptoms of depression and anxiety more intense. That's why managing neurotransmitter-related symptoms is a vital part of comprehensive care. Always consult healthcare professionals for personalized advice, as they can develop treatment plans tailored to individual needs, helping to improve emotional well-being and support overall brain health.